Hi, Sally Walker here, your hormone and slow age expert. So what are some of these disease states which you have an increased risk of developing as your testosterone drops? So we've got things like obesity or putting on weight, extra weight, especially around the tummy, especially around the organs. So this visceral fat, which is highly dangerous, creates inflammation and sets the stage for all kinds of different disease states. So that's one of the things. Diabetes is also more prevalent in adults, not just you males, also we ladies, but adults above the age of 50, okay? Metabolic syndrome, so this is that collection of different parameters, so things like blood sugar, things like insulin, things like high blood pressure, cholesterol, so high LDL, lower HDL, high triglycerides. All of these things combined, the medical world called a metabolic syndrome. So yes, there is an increased risk for that. Cardiovascular disease, so atherosclerosis, which is the hardening of your blood vessels, your arteries, which will increase the risk for heart disease, cardiovascular disease, etc. And we know testosterone plays a very important role there in decreasing inflammatory state in your blood vessel walls. So, then there's something called abdominal aorta aneurysm. Now, this is very prevalent in men as opposed to women, and it is something that you definitely need to keep an eye on because there are not really any warning signals here, and the survival rate if the abdominal aorta ruptures is pretty much zero. So that needs to be checked. We'll talk a little bit about that in the blog as well, so check that article about abdominal aorta aneurysms. So osteoporosis, this is, the crumbly bones or the brittle bones or whatever you want to call it. Now, this is possibly a bigger challenge for men than the medical world are aware of. And this is because we're not doing the testing. It's bad enough with the ladies, we're not doing the testing early enough. But with you boys, it seems to be overlooked. And maybe you will be tested when you have a fracture or break a bone, but maybe you won't. And the challenge with you boys is if you do break your hip, so fall and break your hip, you don't get up again very well at all, where ladies are a little bit better to get up and get going again. You boys tend not to. So it is quite important and can be very challenging. Sarcopenia, very fancy word for loss of muscle tissue, and lots of men complain already from the age of about 45, 50 that they can't build the muscle like they used to. So yes, it is a big challenge, and if you've got low muscle tissue, it's going to affect your ability to burn fat. So it's all part of that obesity, blood sugar, insulin, diabetes thing. Yeah, muscle tissue is really, really important to maintain, increase if you can as we age. So mental health, things like depression. You do also suffer from dementia, but it is most of the ladies that are doing this. So dementia, Alzheimer's, you do get it, but as I said, it is mostly the ladies. But you boys tend to suffer a little bit more with depression, low mood, that kind of thing. So then we've got the prostates, haven't we? Or you have, I don't. So prostate problems like the benign prostate hyperplasia, so the enlarged prostate, which is not cancerous, and then you've got the prostate cancers. So all of these increase as you age, and as I said in the prostate blog, by the time you get to 80, boys, if you don't have an enlarged prostate, you've won the lottery ticket, yeah. Okay, erectile dysfunction. So that's an interesting blog article. So have a read of that, because erectile dysfunction is not necessarily to do with the low testosterone. It's due to something else. So be sure to check that article so you can know what you can do about your erectile dysfunction. And then cancer in general. So as we age, both ladies and men, we have an increased risk of cancer. And you've got to ask the question, why? And I think the liver may have a lot of responsibility here. Anyway, check out the articles in the blog and check out the other videos. Happy hormones, happy life.